Well, a healthy heart is, of course, central to very good health and can, of course, protect us from disease and other medical complications. Now, people with A Fib have a significantly higher risk of stroke than, of course, the average person. Dr. Ronnie Garcia with Baptist Medical Network is here to shed light on what that is and what to look out for. Doctor, welcome.
Thank you. Glad to be here.
Well, you're board-certified cardiovascular disease. We hear about this all the time. What is A Fib and how prevalent is it?
Well, A Fib is the most common arrhythmia seen in adults. It affects us as we get a little bit older. It becomes more prevalent. About 9% of the population over the age of 65 are suffering with it currently. It's characterized as a rapid, fast arrhythmia of the heart, where the top chambers of the heart are no longer contracting but are quivering, and that leads to the sensation of the palpitations.
So what are the risk factors for developing A Fib?
Well, they're actually pretty common. These are the type of things that we see most of us as adults go through: high blood pressure, diabetes, sleep apnea, coronary disease to include vascular and valvular disease, as well as some cases thyroid disease as well.
So what are some of the symptoms? I mean, how would I know if I had it? Would I feel something weird in my chest or what?
Yes, actually fairly common. Patients will present with what they describe as an irregular fast heartbeat. Normally they'll feel this a lot of times when they're at rest. They'll feel like their heart is racing, pounding, skipping beats. In some cases, there are really very minimal symptoms, and a patient can present with sort of shortness of breath and fatigue. What we most worry about is presenting with a complication of stroke, which can be associated with this arrhythmia. Okay,
so I guess the most important question is, are there treatments available?
Yes, there is, and it's sort of in a stepwise fashion. The first thing we try to do is figure out what your risk is for stroke with this arrhythmia. As the top part of the heart is quivering, there's a chance of forming a blood clot, and that blood clot can migrate and cause a stroke. So frequently we have to see what your risk is, and we try to place you on blood thinners. From there, then there are medications that we use to help slow down your heart, or to put it back into a normal rhythm with antiarrhythmic drugs. Further down the line, we have procedures like an A Fib ablation that can give you a more permanent, lasting treatment for keeping the rhythm normal.
So long-term prognosis?
Excellent.
Okay.
With good treatment, which is tailored by your cardiologist, should have minimal symptoms, and the prevention of stroke with medications, oral anticoagulants, is extremely effective. Most patients are able to do a normal life, exercise, anything they want, with routine follow-up and the appropriate medications and keeping the heart rate under control.
Okay, well, to learn more about cardiovascular services, call 833-229-3397 or visit the website baptisthealthsystem.com/cardiocare. Dr. Garcia, great information. Nice chatting with you. Thank you, sir.
Thank you.